Welcome to Greenable Woodbridge. I am your host, Carolyn Ehrlich. Today we're going to talk about the very key to sustainability, and that is our health, both individually and as a community. Now, as all of our viewers have heard me say many, many times, Sustainable Jersey gives us a roadmap to sustainability. They have now given us a new roadmap to health. And until we started going down that road, I didn't realize how much we could do and should do to improve our own health and the health of our community. So the first step on that was to form a task force. And the Health Task Force consists of members of our Department of Health, members of our local hospitals, representatives from there, and an amazing high school student, and some of our residents are interested. And today's guests are members of our task force. We have Rob LaForgia, who is part of Healthier Middlesex, and Councilman Greg Vacara, who is has been a powerful and strong advocate for health, as has Rob. So I'd like to start off a little bit about talking about what makes you so passionate about health, and also, Rob, if you could also explain what Healthier Middlesex is.
Sure. Well, sure. I'll get us started. So, what health means to me and why I'm so passionate about the health and wellness of our community. It really started when I was a child. Cooking with my mom in the kitchen, I really put a importance and a value on having nutritious, healthy foods in the house, and really that's where it kind of stemmed from. And so Healthier Middlesex is led by Robert Wood Johnson University Hospital and St. Peter's University Hospital, along with 65 different community partners across different sectors, via government, nonprofit organizations, academic institutions, and of course the hospitals. And what we do is try to look at the health needs of the community, and we conduct community health needs assessments, and then we draft strategic plans as to how to combat those health disparities in the community. And we do that working with all of our community partners that I just mentioned.
That's great. And why are you so passionate?
Well, I think for me, just like Rob, it kind of goes back to my youth. I've been around people that have been watching their weight. Myself being a high school and collegiate football player and gaining weight and trying to be big and strong and then having to go and lose weight. Somewhere along the line I realized it wasn't about weight, it was about health. So, that was my personal journey. But being affiliated with a town that takes health very seriously, and then consequently getting involved with Rob and Healthier Middlesex, which brings us to the bigger picture, has just been very enlightening. And then it just kind of fans the fire from there. So.
Absolutely. So taking a look at the roadmap, Healthier Middlesex has been working with the hospitals on that roadmap, and we're kind of just trying to catch up, because the first step was a local assessment, and we did that using a lot of the information that you gave us from your assessment, plus input from our residents. And then based on that, we make priority actions, and then the third step would be bringing all health into all of the township policies. So let's start off by talking about the assessment and how we did it, why it was important, and just giving some more information on it.
I think as far as the assessment is concerned, certainly with Sustainable New Jersey, we're trying to attain a status, and it was a requirement. As you said earlier, though, it did open our eyes to things that our community might need. It also was quite pleasant in helping us realize some of the things that we were already doing that was on track. Our involvement with Rob and Healthier Middlesex took it to another level, because although there's a lot of tools out there, there's a lot of, what is it called, civic something or other, where, Rob turned us on to this information that's out there. that actually includes our town, and it gives us data on where things are going on in our town, where the needs are, and I'm sure that Rob can elaborate on it, but it did allow us to take a look at what we're doing and try to help plan for where we should be going, set some goals.
Absolutely.
Yes, and so the hospitals, every 3 years, the hospitals have to conduct a community health needs assessment. It's part of our 501c3 status that keeps us nonprofit. And so, like Greg just mentioned, the hospitals have been doing this in partnership together for over 12 years. Robert Wood Johnson and St. Peter's, recognizing how important this work is for the community. And so yes, like Greg mentioned, there's a lot of data and information that comes along with the health needs assessments, not only similar to what you've done in Woodbridge. We collect surveys from the community, but also we input data from the hospitals, along with secondary health information that comes from the CDC, the state of New Jersey, and any local partner information or data that we're able to kind of input into the needs assessment to really help paint us a picture of what's going on in our community and give us, like you said, a roadmap as to the opportunities that we can improve those health disparities.
Right. One of the things that the assessment pointed out to us were some of the disparities in our community. And fortunately we have new census data, but we also saw that there were parts of our community that go to the emergency room more often, which seems to be a sign of they don't have a regular doctor, maybe they don't have insurance. So do you want to talk a little bit about how we reacted to that? What kind of actions did we do once we were kind of alerted to it and surprised by that disparity?
Yeah, I think that, and it's a credit to Mayor McCormick and certainly to you, that when we recognize those things, we realize very quickly that we can't expect people to come to a location. We have a wonderful health department, we have a wonderful health building, and it's centrally located, but maybe it's not easy for everybody to get there. It was through your actions that we decided to take it to where the people are and where the need is. And in particular, I'm thinking right now of Caseby. A number of years now, through Councilwoman Lisbeth De Jesus, we did the community program in the park there where we distributed backpacks right before school, but we took it to another level. Raritan Bay Medical Center brought out their mobile health unit. We did some basic diagnostic stuff that we know led to other things and really helped people to, what we're looking for, I think, is to get them involved in the system so that they know where to go when they have medical needs. And so really, I think to sum that all up, it's like taking it to the people and then not expect the people to come to us.
And Rob, do you have experience with that through the hospital?
Well, I couldn't agree with Greg more, especially in the years of COVID.
Yes.
We've really seen disparities grow amongst socioeconomic and demographic information and people. And so really like Greg said, our goal, even when COVID hit, was to understand, we knew that, we understand that, and we have to take our resources to the population, whether it be creating testing sites in centrally located areas or setting up vaccine distribution sites in areas where there's high congregation. Those are the kind of steps that we have to take in order to really move the needle and see changes in the community.
And for there to be a healthy community, everybody's health has to be looked after. So one of the great outcomes of our assessment and this disparity issue was we have a redeveloper in Caseby, and he is donating the town a health mobile to the township. Unfortunately, like every other supply chain issue, it's a year until we get it. But we're also very excited about having that, and it's mobile, so it will go all over the town wherever we have people gathering, even at concerts. It'll be there.
That's
so
fantastic.
if you want blood pressures, whatever, everybody can take advantage of it. Changing the subject a little bit, but it's the but before I go to policies, were there other steps that we thought were important that we should take as priority steps?
Well, I think, and I believe it was a requirement, but again, if I'm kind of dropping names here, but Dia from the...
I was hoping you mentioned her.
I mean, she's amazing, right? I mean,
Yep.
we were very concerned that all of the town was represented, in particular the youth, because let's face it, we all say they're the future.
Right.
We need to treat them like they're the future, and Dia stepped up to the plate. She was very active in creating our local assessment and getting it out to students. So I think that that was important as we formulated our core committee, and she made just about every meeting. If she didn't, she was at some kind of leadership conference somewhere.
Right.
And she's going to be a future leader in this town for sure.
Absolutely.
If she stays
Could
here.
possibly be the country. That's how great she is.
Yeah, she's wonderful.
So as long as we're on the subject of Dia, one of the things that I really like about her is she takes the initiative. She doesn't wait for somebody to ask her to do something. She has an idea. She will ask, is it okay? And of course we'll say, of course. But the mental health, how she brought up mental health to all of us, and talk about that evaluation that she did with her classmates.
Rob, you want to?
Yeah, sure. So with the advisement of the Health Task Force and the core group that's around the table, Dia was able to devise some questions and develop a survey to go out to the student population in Woodbridge. And what we were able to really gain from that was just, especially in the most recent times during the pandemic, just the amount of stress that students are under and the different mental health challenges that they face on a daily basis, whether it be working, schooling remotely, getting back in person, and just some of the difficulties that students face nowadays. And so we were able to take that information and put it into our action plan, so that way we can try to actually take steps to ensure that the population knows about these issues and knows who can help with them.
Absolutely. And not only for our students, but the mental health of our adults,
Of course.
has been a great issue. And that's something you've been working with Bonnie Nolan.
Yeah.
And our police department is playing a very different role with Rutgers now. And I read in the paper today that there's a new hotline for mental health.
Yes, 988.
988. Oh,
Yes.
okay. So do you want to talk?
Rob sent out
Okay.
information.
So you want to talk about that a little bit?
Sure. So you can think of 988 as the 911 for mental health services. It's just rolling out, so we're going to see how everything turns out with it. But so far, the pilot programs have been phenomenal. It's federally funded, so it's going to be here for a while, which is really great. And we're excited to see how it's utilized and how that information from that can be shared to the community, and how that information can be shared to community providers, so that way we can understand from a provider standpoint, how can we best serve our community even more?
Offer a service and we can learn from that service.
Exactly.
That is great. Now, the third major step that Sustainable Jersey told us to take was to include policies, to include health in all of our policies. And when I saw that, I have to admit, I kind of freaked out a little. I said, how can we possibly do that? You have no idea how many policies we have. But as a councilman, you took a class, you took control of that, and you made it happen. You were a true leader in that. So do you want to talk about that?
Well, I think, again, it's affiliation with Healthier Middlesex and learning about health in all policies, and even being exposed to that class. It was through Rob that I even heard about it, and then when we had our meeting with Sustainable New Jersey, they talked about it. So I think the ultimate thing there was all of our directors, regardless of where they were, code enforcement, building, public works, we thought that they wouldn't quite understand that. The fact of the matter is not only did they understand it, but they embraced it.
Right.
So that makes a point. So anytime you're looking to do anything in our town, you consider the health aspect of it, whether it's road resurfacing or building, the new apartments that are around and what impact it has on the community. And the council passed a simple resolution that said that it would be considered, but it is really the staff and the administration that interprets what that policy is. And that's an ongoing thing now, but now when resolutions come before us, if you read the fine print, it talks about the health impact that they foresee that could come from this. So, it's a very interesting, and it really puts teeth into Woodbridge being serious about the health of our community.
Exactly.
So.
And most of what we do impacted health anyways, because we've always been trying to do the best that we can for our residents. That's what we do.
Right.
But when you point out the health outcomes that these actions have, like you mentioned the apartments downtown. I mean, they do have a health aspect.
Right,
do you want to talk about what that is there? Yeah, go ahead.
Yeah, just quickly from what I see is, for example, the what is it, Fermella down by Wegmans down there. Simple things like, sure, they got beautiful gyms and everything for the people that live there, and there's walkways and everything else, and ultimately there will be stores. So it's really a self-sustaining, which in itself will cut down on pollution, which has an effect. But simple things like the shuttle to the train station or to go to various places, which are putting less pollutants in the air. The construction, the Greenable construction of it in itself. The places locally here, we're at Town Hall, where the studio is, these folks are walking. Already you can see a buzz on Main Street. There's more walking going on. There's more biking going on. So those are factors. That didn't just happen by mistake. That was part of the plan.
Right.
That we knew that, yes, are we increasing density? Of course. But are we doing it in a smart way? So it's redevelopment in a smart way, or smart redevelopment, however you want to word it. Rob, that's just my local take on it.
No, I couldn't agree with you more. I think when we think about decision making and policymakers, it's important that they have all the facts too. And so incorporating a health in all policies approach and looking at the potential health impacts, whether it be positive or negative, has a very strong arm when it comes to informing the policymakers about the program or policy that they feel like they need to implement. And so I like I said, I couldn't agree more. I think looking at the potential health effects and informing the community about them too is very important and critical to even moving things along to be passed. So it's so important.
They might not understand, for instance, why would we be building a warehouse, but when it becomes part of remediation and we're getting rid of all the contaminants that are in the ground and in the air, it is a health benefit. And by pointing this out as part of the policies, people understand more about it.
Right.
So,
and it's really about bringing health to the areas in which traditionally we don't think about health, like transportation and land use, like you're just mentioning.
Right.
And so just having a complete picture before moving on an action is key.
So in the transportation area, what kind of things can we do?
Well, I think, we've mentioned the shuttle buses from places. We have our senior transportation, which started out very specific and now has grown somewhat, where we move, and the seniors just absolutely love it.
They do.
Not only does it get in the shopping, their medical appointments, but to some of the social events, which are so important when you talk about mental health. Our bike sharing program.
I was waiting for you to say that.
I mean, it's, that program has developed, it's free of charge. It's in the hot spots around town. And it's incredible when you see those bikes out on the road.
Right.
And, it's just a very easy process. There were some bumps in the road that we worked with our strategic partners to get ironed out. But, those kind of things and just making town more walkable. And just, again, things like this. Our show now that we're pointing it out, who's watching it and is learning about some of the things that are available.
And when you start putting a microscope on health, as we are doing now, people will start thinking about it more, and how what am I doing? How does it impact it? You know, you're walking the dog,
Right.
and that's good for your health. But
Right.
you might not have been thinking about it.
And
It's just a chore.
It's also important to think about safety too when we think about transportation as well, because if folks don't feel safe in their community, the likelihood that they're going to go out for a walk is far less likely. So looking at the potential impacts when it comes to where bike lanes are, where transportation stops are put, and looking at the safety of the community, all those factors really contribute to creating a better, more equitable transportation system around the area.
That's true. Another thing that having all of the directors involved in the health issue is that departments can now talk to each other and should want to talk to each other about what they're doing and how they're doing it. Can you give any examples of that?
Well, I think just in general, having Phil and Ashley on our committee, they're just such a valuable resource. Phil is out in the community because he's a health inspector.
Right.
Ashley is a health educator. She's part of Healthier Middlesex too.
Yep.
Having them available, and they're not afraid to go out there and put their input, you know, invest themselves into whatever projects
Right.
are going on. So yeah, I think, you know, and Marta is so interested and so into this herself that she keeps these things involved. And as you said initially, having the resources of our health department in Ashley and Phil, and quite frankly Dennis, the director, and have them sit in on these meetings just allows for this kind of dialogue to happen. And now that we've put a focus on it, it happens organically. Nobody's forcing them to have the conversation.
Right.
It's happening organically. So it escapes me to give you a specific.
I have one.
Go ahead.
So we have a new computer system now in the township. It's for the town hall and all the people who work here. But if the building department goes out, and we don't have this too often in town anymore, but if for some reason they're inspecting something and they see peeling lead paint on the walls, they can very easily send that report now over to the health department so they can follow up.
Great.
Before we talked about this at staff meetings, as with all the directors, there were silos, there were walls. You know, okay, this is the building department issue, we don't deal with peeling paint, so never mind. But yes, you have to deal with that. And so it goes over to the Department of Health, where they would deal with it.
Right.
So it's just, you know, having everybody talk about this is what makes a difference.
And we've seen that in public health probably, I want to say over the last decade, that there's been a real shift in public health and how we look at combating a lot of these health disparities and recognizing that hospitals, health departments, et cetera, can't do this work alone. And so recognizing that you need to work across sectors, across collaboratives with one another, and recognize that, you know, we are all working towards the same goal, the end goal. And having one mission and one value with a collection of different sectors is so valuable in moving the needle.
Absolutely. So one of a term that keeps popping out at me is creating a culture of health. And I think we've described it a bit here, but how would you generalize what a culture of health is and explain how what we're doing helps to create that culture? Did I stump
like to
you?
take the-
Yeah, I think locally everything that we've discussed so far on the show is pointing in that direction, and it's certainly it's TV shows like this, and whether it's the sharing the bike program or the senior transportation. It is very public with our initiatives for health. And when the community starts buying in, you know, you and I have been at this so much.
Yes.
Like I'll have people come up to me and say, lost 5 pounds, or, did you?
And they're telling you like you're the doctor.
Did you do your 5 miles today? And it's a culture. It's
Yes.
no longer like something we brought up that, this is a nice, light, good idea back, whatever it was, 16 years ago.
Right.
But it is ingrained in people's minds now, and it is a way of life. And once it becomes a way of life, then it is a culture.
Yes.
Then it becomes a culture.
Right.
It's not something I'm going to do, lose 5 pounds, and then go back and eat whatever I want to eat. So I don't know if that answers the question.
Yeah, it really does.
I think that was a great answer. For me personally, a culture of health really envisions a environment where everybody, regardless of socioeconomic or demographic background, has an equal and equitable opportunity to live their healthiest life. And I know that's a very broad and general type statement, but the things that can fall under that umbrella are vast and community-led, and just like Greg mentioned, it's everything that we're doing within the Sustainable Jersey and the Health Task Force is all working towards developing that environment where everybody has that opportunity to be healthy. So you guys are doing a great job. So it's fantastic to watch.
So I guess to sum it up is the ultimate culture of health is when everybody is working for their own individual health as a person, as an individual, and then working toward the health of the community. If I have that right. We have
I would agree.
about 1 minute left. Do you have any summaries, last comments you'd like to make?
I just think, from my perspective, to follow up on what Rob just said, I just think our community is so big. There is, I don't know if I want to call it a hidden population. We do have a population of people that are not as engaged as others, and I think by taking it to the people and to go where they live, we have to really work hard to engage all people, regardless of their status economically, what their culture is. That's something that I think that we could continue to work on. We are, and I think we need to continue to do that.
And I would just lastly say that communication is really the biggest and most important thing for the community. Whether it be whatever we're working on within Sustainable Jersey or the Health Task Force or whatever else is going on within the city, making sure that information gets out to the community in an appropriate way, in a way that's most appropriate for them and their demographics, is super important and will create tenfold the betterment with the community. So I couldn't agree more.
And my closing remark would be a quote by Senator Booker, which I have as part of my mantra every morning. And he said, "Health and fitness is a lifestyle. It's not just something you do for an hour every day," which reminds me, I'm doing my workout, but it doesn't end there.
Right.
And I think for everybody, it's a lifestyle that we should be striving for.
That's why I like him so much.
So this has been a very, very informative show, and I thank you so much for taking the time to come here.
Thank you.
Thanks for having us.
Thank you for watching Greenable Woodbridge and being part of the excitement and part of the change.